this is what, so in the same study that we just reported, it was shown that enablement is whether a patient feels that they're better able to deal with their condition. Empathy means that they felt the doctor cared, listened, understood. You could get empathy without enablement, but you never got enablement without empathy. In a study of 3,000 encounters. So the nature of the relationship is key. You can't enable a high-quality relationship there to begin with. I mentioned the care class study. And briefly the results are that the innate practices randomized 76 patients to extra time. It was only about an hour over 6 months. It allowed a long initial consultation following the agenda that was established. And these are the deprived practices in Scotland. And what the study shows is it's not that you can't do randomizing very deprived practices, it's just that they aren't done. It's difficult, but they can be done. And the results show here, measuring quality of life on the left at the beginning, in those getting extra time, in blue or not, in red, against 6 months later, quality of life is greater after 6 months and patients get more time. And if you use another measure, which is a measure of negative well-being, it goes up after 6 months if people don't get the extra time. And that's a very big relief. The worst thing that could happen would be that there was nothing to find. It was a relief to find that it did make a difference. But the difference was of a particular kind. It wasn't that the patients getting the extra time were improved. It was that the patients who didn't get it got worse. Now, that's what Starfield says. The major impact of health services is on the severity and progression of ill health. So if you don't deliver what healthcare can deliver, severity will be worse, the progression will be quicker. And like always, the policy of universal access to ski is better understood in this country than in Scotland. The policy of universal access to ski wax is that people go downhill very quickly. And if you under-resource the health system, they will go downhill quicker than they need to. That's what equitable healthcare is trying to reverse, the slow decline. In Scotland, 10% of patients with 4 or more conditions account for a third of all unplanned admissions to hospital and a half with potentially preventable unplanned admissions. There's a lot to